Now, talking about health, of course, we do know that the doctors' strike was ended yesterday after 100 days, and we'd like to have that conversation. And joining us with Prof to have that conversation is Dr. Mercy Korir. Good morning, and thank you for coming in. And maybe let's just start by, first of all, letting Kenya know what exactly transpired. And now that it has been signed, what does that mean?
Well, the ceremony yesterday was basically one to call off the strike and sign a return to work formula for the doctors. After any strike, there has to be an avenue or a process of going back to work. The document that the doctors signed, one, guaranteed them the allowances that had been negotiated over their 100 days. That was the change of the emergency call allowance to the doctor's allowance and an increase on the same allowance and an additional 20,000 Kenya shillings per doctor per month as a risk allowance. This is what took the doctors back to work. Secondly, there was a clause of no victimization. And from the understanding that we got from the meeting yesterday was that there will be no disciplinary action on the doctors. If there were any pending disciplinary action, they should be withdrawn. Those who are sacked will be reinstated, and the salaries of the doctors for the last 100 days that they've been out of work will be paid. Secondly was withdrawal of all the cases that had been filed against the doctors. And thirdly, and what is most important for the doctors, was the collective bargaining agreement, which the doctors expect the government will sign and start implementing in the next 60 days.
So the CBA is still a pending issue as we speak?
They said that they had discussed the text of the CBA, they had discussed the Annex E of the new harmonized CBA that incorporated both the county governments and the national government, and now the compromise from the doctors was to have it finally signed by the government in 60 days, because now it was becoming and the government was insisting on the 60 days. The doctors wanted immediately, so somebody had to make a concession somewhere. And in this case, the doctors did make a concession.
Okay. So help us understand, what is it that took 100 days for this to happen?
Well, it has been drama and intrigues, as we have seen. The negotiations, when they were close to clinching a deal, they collapsed, something would collapse, there would be misunderstanding, there would be all sorts of things. And we started from a point where it was about money. Then we finally understood that it was about the collective bargaining agreement that the doctors were looking for. Then it was a whole discussion of the collective bargaining agreement through different mediators. When that failed, they had to restart again. So it's been a lot of push and pull behind the scenes that saw talks collapse, some make progress, and finally, I think from the pronouncements that were made during the devolution conference, somebody had to make a concession, or really, it was long overdue. I think past the 100-day mark now, it would have been more pain and agony for Kenya. So somebody had to make a concession and go back to a formula or a work in progress formula.
Excuse me, I'll come back to you on what that means for the Mwananchi, because I think the person that probably paid the highest price out of this is probably the Mwananchi himself. But maybe coming to you, Prof, and looking at the 100 days in retrospect, and also reflecting on the State of the Nation address that we're expecting this afternoon from the President, is health a big thing that possibly should be addressed? And given, again, we are heading towards the election, it would be a fantastic platform for him to campaign, as it has been said.
In relation to the State of the Nation address, I think it is a good thing for the President that he is making this address as the doctors have returned back to work. I think it is good on the political side of things. Like you have said, no one is going to pay the price for this strike like the people of Kenya have paid. Earlier on, we were talking about the statement that had been attributed to the Secretary of KMPDU, saying that the people of Kenya have paid the same price as the doctors in this strike. And Dr. here is telling us that there is absolutely no price to pay as far as the doctors are concerned. They are going to be paid for the days they're on strike. Nobody's going to be intimidated. Proceedings against anybody on disciplinary lines are going to be withdrawn.
Those who had been fired,
those who've been fired are going to be reinstated. So doctors are going to walk back into the hospitals and their lives are going to go on as if nothing happened. The president is going to go to Parliament today, and he is going to be fairly confident and fairly upbeat about the fact that the crisis has been solved. The question is, has it been solved? At what cost? And to who? My answer is, it hasn't been solved. The cost has been paid by the people, and the antagonists are going to walk out of it feeling pretty satisfied with themselves.
Dr. Do you agree that...
No, most definitely not, because when we say the doctors haven't paid the price, for the last 100 days, doctors have been surviving on basically nothing. 2 doctors are also Kenyans who have relatives and friends who have also gone through the suffering. We have doctors who have been directly affected by the strike. So when we say doctors are going to go back scot-free, I think that's a bit...
it's a bit unfair for the doctors.
It's a bit unfair for the doctors, and it's a bit myopic to look at it on just that prism alone. And secondly, as you said rightly, well, I agree with him, the problem has not been solved. We'll go back. The budget estimates for the 2017-2018 health is at 2.9% of the national budget. The Abuja Declaration, where Kenya is a signatory, says that we should have our health budget to at least 15% of the national budget. So when you look at the budgetary allocation and what we are saying we have solved in the health crisis, we are far cry from it, because the doctors will go back, will still probably go back to the same problems that are there. Are our hospitals better equipped? Are our hospitals better stocked? Are our doctors well or better trained? Our nurses and our clinical officers? The problems bedeviling the health sector will still remain if we do not address them nationally. And what I would expect the president to address is, are we increasing the budgetary allocation to health so that we do not see what we've been seeing for the last 100 days. And for the last 100 days, it's not only doctors who've been on strike. The nurses were on strike. They ended theirs on the 14th of December. The clinical officers have been on strike on and off. We have the lab technicians and the other healthcare workers who are also disgruntled, and they've also been complaining. So the problems, this was just, to me, an
icebreaker. And help us understand, Daktari, because you've agreed with Prof that the problem, one, has not been solved. So looking at it now in retrospect and, with hindsight, the 100 days, Kenyans, doctors included, have paid the price of losing their loved ones, having the health sector completely disrupted. Was the 100 days a waste of time?
Well, if you look at it from that there were no public health services, then a lot of time and a lot of people's time was wasted. If these parties had not gone through the shenanigans that were there, then we would have solved it within the first week or 2, because it was just a matter of agreeing on, because the argument was there was no CBA, there is a CBA, and finally they came to agree and discuss a CBA. All these things, if they were serious about discussing it, it would have been finished within the first two weeks at most, or even prior to the strike, because the strike notice was given on the 14th of November. Those are questions and issues that would have been addressed before that.
Okay, I understand that, and my question is more to the fact that, yes, it could have taken a much lesser time, but given that after 100 days, you say that still the problem has not been solved. Do those 100 days really, have we made ground in terms of the grievances that were there, apart from the fact that maybe the doctors got a pay increase?
The grounds we have made could be is we have brought out the issues, or the doctors have brought out the issues that are bedeviling the health sector. They have brought them to the fore, to the public. We've had people discussing. We've had Kenyans bringing out the issues that they face in the public health sector. So in my own opinion and perspective, I think we have made ground in bringing the health sector as a point of discussion, and we'll expect it to be a point of discussion, 1, in the state of the nation, and 2, as the politicians go out to campaign and to seek for votes, we expect that after all these 100 days, then this is a topic of national discussion.
All right. Prof, do you think any ground has been gained by the strike?
Well, from the point of view of the good doctor, nothing has been gained. To say that the strike has brought to the fore issues of health in this country. Issues of health in this country has been to the fore ever since independence days. I don't think that there are any new issues that have been brought to the fore in this strike that we didn't know of before the strike. I will still insist that for anybody to make the argument that the doctors have paid any price on this is, I mean, if for me making that argument is myopic as far as the good doctor is concerned, it is an argument that I'm going to make, and it's an argument I'm going to insist on, that the price for this strike has been paid for by the blood and lives of Kenyans. None of the doctors has died, none of the doctors will be sacked, none of the doctors will face any disciplinary action.
That may be true, Prof, but
yes.
the thing...
In fact, it's not true. We lost a doctor during the strike.
Yeah.
Yes, so the doctors have paid the price.
The
price.
doctors...
And also, Prof,
yes.
The fact that we're discussing this right now,
yes,
it can be viewed as ground made, because
yeah.
if they had not been on strike,
yeah.
we still would be having a health sector that is bedeviled by many problems,
yeah.
but it would not be a subject of discussion. That can be looked at as a gain. And the fact that we're discussing it, that could be ground that has been made.
I don't know that I want to be discussing health crisis at the backdrop of the kind of suffering that Kenyans have undergone. I could put the question differently, Michael. Would it have been possible for us to have this discussion without putting the lives of Kenyans on the line? It would have been possible. But the doctors chose a different path in terms of bringing this discussion to the fore. That is number one. Number two, in terms of what we have been told about resolving the crisis, remember that once the doctors started losing the support of Kenyans in terms of the longevity of the strike, they started making an argument, Michael, and I don't know whether you remember this argument, that this strike is not about their pay. This strike is about health sector and health services delivery and blah, 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 blah. What we have seen in terms of the package we've been told in terms of the resolution of this impasse has nothing to do with the state of health. It has everything to do with the new perks that the doctors are going to enjoy. Meaning that from the beginning, this was an argument about pay, but they needed to bolster this argument to get the support of Kenyans by saying that it's about health services. If the strike was about delivery of health services and the quality of health services to Kenyans, there is nothing in the resolution that speaks to that fact, and Kenyans are going to go back to the same health service system that was there 100 days before now. And therefore, when we say that there has been any gains, I cannot see the gains to Kenyans over this issue. I think that the government, the political class, and the doctors can make their own assessments of their gains, but for the people, the doctors come back from 100 days strike with nothing for the people.
All right, and I think to be fair to the doctors, Mercy, maybe break it down for us. What benefit are we likely to have out of this deal that has been struck going forward? Now that the doctors are back to the hospitals, what's going to change?
Unfortunately, we have to wait for another 60 days for the CBA to be signed by the government, despite it having been looked at over the last 100 days by different parties from the government and discussed. And in this CBA, one was, and what is an important clause to the Kenyans, was that the government to employ 1,200 new doctors annually to bridge the gap, the doctor-patient ratio in the country, because right now we are at 1 doctor to 10,000 Kenyans. So if annually the government increased the number of doctors, then there's a gain. 2 is on training. Remember, the government has been very loud in telling Kenyans about the managed equipment services, that they have equipped hospitals with dialysis machines, with ICU and theater, but where are the staff to run and to manage this? And in this CBA, training is a key component where we'll have nephrologists trained, these are kidney specialists, we'll have anesthesiologists who will be critical care doctors, and other cadres to be able to be the skilled workforce to run these facilities. And those two, and as the Union Secretary General has been saying, you cannot separate the rights of the doctors from the rights of the patients, because a well-trained doctor, a well-remunerated doctor, a well-motivated doctor translates directly to the patient getting good care despite the limited environment. I always say, working in public facilities where you have very little most of the time, you're forced to improvise. So if you're not a well-trained person who can think out of the box in order to help your patient, then many people would be dying. And the argument has been that, you know, the doctors being on strike and not being on strike, there's been no difference. But we've seen that the number of casualties that have been there during this strike are more than when the doctors have been at work. They've been at work in deplorable conditions, but they've been able to manage because they can improvise, they can think out of the box, they can, they can work miracles for patients. So we expect that when they go back to work, or when the government signs this CBA and implements it, actually the onus is on the government, then that improved human resource for health, which is the doctors, will translate to the patients. So it's not an entire gain to the doctors only, but also to we, the Kenyan public.
Okay. Prof, what would be an ideal health sector, given what Kenya has gone through and the fact that the government raises one of the impediments or challenges being, of course, finance? And Daktari here has alluded to the fact that with the new CBA, there's certain budget allocations that are expected to improve. So, of course, it's not something that we're expecting to change tomorrow. It's not something we may not even see a difference in the next 1 year. But if we start today, somebody once said that the reason why you sit under the shade of a tree is because somebody planted a tree some time ago. So we need to plant that tree now. What is ideal? What should the government be doing now so that we can see progress 5 years, 10 years, 15 years to come?
CBA, Michael, the one you're referring, if I got the good doctor right, has not been signed.
We have 60 days.
Yeah, so we are talking about a document that has not been signed. They have gone back to work with the document that has not been signed. They could have gone back to work second day, third day, first week, second week. That's number one. Number two, I do agree with the good doctor that they work under difficult circumstances, and that those circumstances do need to be improved for the patients, and they need to be improved for the doctors. What I have consistently said is that we need to define what is healthcare. We need to define where do we put our priorities. Because the question of development in this country is twinned with the question of corruption. You will find that government decisions in relation to health are made on the basis of where can the people in government and the politicians make a lot of money. You remember there are some containers that are seated somewhere that Marwa does not want and wants them removed. And you ask yourself, were those more urgent than what she is saying in terms of training of people? Because ideally, good healthcare is about good healthcare providers first. You are not going, if I give you a very nice machine here, Michael, state-of-the-art machine for doing whatever they do, you're not going to do anything with it. The machine is there, but you're not going to do anything with it. But she has said that with properly trained personnel, even without very good equipment, it is possible to improvise. It is possible to be innovative. So if I was to answer your question, I would say that for me, the most urgent sector in terms of improving health should be training the people who are working there. Can we make sure that we invest enough in that? Are we going to do that? I don't think we're going to do that in this government or with the current political class, because remember, the first consideration about development and the first consideration about what the government is going to do is opportunity for corruption. And training doesn't have, when I take you to school, I'm not going to get a lot.
Let me pause you a little bit there,
Yeah.
Professor. We'd like to